puberty that we don't talk about. We talk about midlife crises, but we don't talk about all of the things that happen at midlife for women and men, but really for women. And so while this class is not covering that, I will touch on some of those things. So we'll talk about the importance of health screenings for people who are over the age of 40. We'll talk about some useful strategies for weight loss and health management for individuals, and then how to stay fit for individuals after you reach 40. So the 40s and beyond are really a turning point. In the football game of life, we're kind of at halftime, right? And halftime is where, we go in, at least at Alabama, and we get our heads back in the game, right? It's where we get the pep talk. It's where we figure out where we are, where we're going, what we need to do in this next half that we have. Um, and I would say that that's pretty true to life for us in our 40s. Everything isn't about football, but when you're at UA, it's a fun analogy metaphor that you can use sometimes. And I read a book recently that said, "You're just at halftime. Don't worry about it," as you're approaching 40. And so our metabolism slows, our hormones shift, our recovery changes, our rest that we need changes. And then we have a lot of prevention and health maintenance that becomes really critical and key to our health. So when you're thinking about, how to assess yourself, we think about physical activity, healthy diet, quality sleep, brain stimulation, relationships, and purpose. So these really connect to the Strive for Five that we're wrapping up here soon. And the things that I would say to add to it, so kind of Abby's additions, would be hormonal and metabolic health, preventative care, sleep and recovery, and habits and mindset. And you could even put rest and recovery there as well. And so those are really important in terms of the 5 pillars of healthy aging, and then some of the things that you want to pay attention to in the Abby's additions. So midlife is sometimes seen as a crisis. Um, I like to think about it as a chrysalis, so where we cocoon like a butterfly before it emerges. We get into kind of like this chrysalis where we're going from caterpillar to butterfly. And I don't know if you guys did this when y'all are in elementary school, but I had some amazing teachers. That's why I am a teacher now. I identify as much as a teacher as I do as a nurse. And I had some amazing, phenomenal teachers that were really life-giving and really wanted to teach us well. And she actually got a butterfly kit when we were in school in the spring, and she let us watch the cocoon and all of the stages of caterpillar transforming into this butterfly. And it's funny because my grandmother, who was like a second parent to me, she loved monarch butterflies. She loved all butterflies, but monarchs were her favorite. And my first school play, when I was probably in first grade, kindergarten, first grade, they assigned us all our costumes, and they said, "Abby, you're going to get to be one of our butterflies. We don't have very many of them, but you're going to get to be that. Can you make a costume for that?" And so I remember getting off the school bus and going to my grandmother's house and saying, "Can you make a butterfly costume for me?" I was one of the lucky few that got to do that. And she said, "I sure can." And I remember going to her house and moving butterfly magnets on her fridge. And so when I read that about midlife doesn't have to be a crisis, it could be that you're in a chrysalis and that you're going to bloom. It took me back to that school project and that play where that gets really ugly and soupy and messy when the caterpillar is transforming. And, it's the quote about you sometimes feel like you're being buried alive, but you're really just being planted to bloom. And that's what the butterfly is doing. It's blooming out of this chrysalis. So Brene Brown says, midlife, it seems as if we spend the first half of our lives shutting down feelings to stop the hurt, and the second half trying to open everything back up to heal the hurt. I just finished a training last week on the Enneagram, and they were talking about the importance of your first half of your life is all about identity. It's about identity formation, relationships, career building. And the second half of your life is really about wisdom and continuing those relationships and really connecting to your true essence and your purpose. And so while we might have all these health concerns on this page, the chronic pain, the arthritis, the generalized pain, the health concerns around mental health. We might have high blood pressure, which is really, really common, or high cholesterol, or things like that. We also have this really unique opportunity to utilize all of the good things that we've learned, all of the good things that we've picked up on our journey along the way, and really start to bloom like that butterfly. And so there are many things that you can do to address these common health concerns that honestly can happen at any age. But aging doesn't have to mean that you're going to have all of these health concerns. So, screening and prevention are really the keys to healthy living. And that's what's so great about Wellbama is we have so many resources. You've got Hinge Health for physical therapy, which I love and use. We've got Lark, we've got Verta, we've got Livongo, programs that help manage things like diabetes and high blood pressure. We've got these great initiatives and events that Miranda just told you about in terms of like getting your shoe size. Nurses love to take care of their feet because we're on our feet for so many hours. We work 12-hour shifts and we're moving constantly. And I have always struggled to find shoes that fit my feet because my feet are fairly wide. And I went and had this scan done and got a pair of shoes that I would never have chosen for myself just because I would not have picked that style or that color or, whatever it is about it. But it was so helpful for me when I was doing clinical. And I was telling Miranda every day I was in my Wellbama clinicals, my feet are killing me, but I'm wearing these really expensive Hokas. And it turns out Hoka is just not a good shoe for me. It's a cute shoe, but it's just not the best fit for me. And so, really capitalizing on the events that, we have, the offerings that we have that are free. It's such a great benefit that so many others don't have. And I think because we're so used to having these amazing opportunities at UA, like I forget, my hand is raised. I forget how amazing and how fortunate we are to have them. And so really start to utilize the screenings, the preventions, the um, blood work and numbers that you can get from Wellbama, and then also just the community and the connection, right? I bet you guys probably are doing all these things because that's why you're here at lunchtime on a Thursday. That should be a Friday. But creating a lot of conversation around this so that you get other people on board, right? We're like the people that we hang out with. The top 5 people we hang out with is usually who we act like. There's been research that's been shown if we are near high performers, like within 30 feet of a positive high performer, we're more likely to be positive and a high performer. But the reverse is unfortunately true. If we're around people who aren't as positive or aren't performing well, and we're within like 30 feet or so of those people, then we tend to act like that too. And so we really get to be kind of the positive change that we want to see in the world. And so sharing things that we do at Wellbema is one great way to create community and to start kind of that positive chain reaction. So with the Wellbema screening, you guys probably know, but you get data on your heart health, your blood pressure, your cholesterol, your triglycerides, your blood sugar or your blood glucose, your BMI, your health risk, and just your activity levels. And you also get to set goals, which is really helpful. We recommend that you pair that with an annual physical exam. So, an annual physical exam is recommended for everyone who is in adult years, so not just over the age of 40, but a routine physical exam with your healthcare provider, and that might be a physician's associate, a nurse practitioner, or a medical doctor, will help screen you for medical issues. It'll help assess your risk for future issues. They'll be able to document your health history and get a good baseline. So much about going and getting a screening with a medical provider is that when things come up later in life, as they inevitably do, then you can go back and say, okay, well, at 30, at 35, at 40, we weren't seeing these issues. So knowing when something develops and how it develops is actually a really good indicator of like your health outcomes and how you're going to manage these kinds of diseases and processes. So, updating your immunizations, practicing a healthy lifestyle, and just building that relationship with your healthcare provider is important, right? When you're going in because you're sick, because you've got COVID, because your blood pressure is high, that is not a great time to build a relationship with your healthcare provider. So they really need to know your baseline so that when you are sick, they know, okay, this is unusual for Abby. She's usually not that snappy, or she's usually not going to respond in that way. So something is off. But if they only ever see you occasionally or when you're sick, then you don't have that established relationship and baseline, and they're not going to be able to help you to the degree that they could if you did have that strong rapport. So health recommendations, there are two slides of these, and these are the minimum recommendations. So the annual physical exam with lab work, your dental exam and cleaning twice a year, your hearing screening every 10 years after the age of 50, and then 3 years after that. So that would be a minimum recommendation unless you're having difficulty hearing. If you're saying huh or missing information a lot, it could be that you're distracted, but it also might be that you're having some age-related hearing changes. Our hearing changes throughout our lifetime, much like it does with our eyes, but we don't talk about that as often. I have a son with a hearing impairment. He was born with hearing loss, and so he has been wearing hearing aids since he was 5 months old. So I learned a lot about hearing that I never really anticipated. I sometimes can be extra loud because I have a lot of chronic fluid on my ears, and I actually have 10% hearing loss in my left ear. We apparently have genetic hearing loss in our family, and so it comes from my side, and we found that out through genetic testing. But my son, through his treatments and his speech therapy and all of those things, I learned a lot about hearing that I probably wouldn't have known about just by living life or even going to nursing school. And so there are 3 or 4 points throughout our lives where hearing changes, and midlife is one of those. It also does as we get into those like geriatric years, which tend to be like the older, like 60, 65 plus. That is kind of the label that they give it for medical terms. Of course, anyone who is in that age range, you are still very much young in my book, because we're trying to live to be 100 around here. So you're still in the barely over halftime of your life. But it does help to know some of those data points. A comprehensive eye exam with pupil dilation, so having that done annually, it's really important that they can dilate your eyes so that they can look at the health of the vessels and the retina in your eyes, and be able to see if there's any changes there. Also monitoring for glaucoma. Glaucoma is on a spectrum or a continuum like everything in health. And so your ocular pressure in your eye can change, which is the diagnosis glaucoma when it's sustained. So catching that early really can reverse it. I had high ocular pressure starting in my late 20s, and I was able to make some changes that indirectly can influence your ocular pressure. I actually have a sibling and 2 parents and at least one grandparent that had high ocular pressure and was diagnosed with glaucoma and eye floaters. And so I have always gone more than the recommendation for my age just to stay on top of those things. And I was actually able to reverse the ocular pressure in my eyes because of those changes. So it's always good to just be aware of what you're more at risk for. Blood pressure screenings. I have people in my life that are older that said, I'm really convinced that around age 34 is when everyone develops high blood pressure. And I don't have any data to support this, but it is true. In my anecdotal stories around my friends and my life, that is when my high blood pressure started at 34. And I was on high blood pressure medication, antihypertensives for 3 years, and was able to actually wean off of those medications, which is pretty unheard of with diet and lifestyle and losing weight. And so these are things that we sometimes think we'll always take a medication for it and we'll always have it, but they actually can be changed if caught early. And that is the beauty of preventions and screenings. Diabetes screenings are really good to have annually. We can do the glucose check, that's just the quick check at the Wellbama screening, but it's great to go get blood work because they can look over the last 90 days, and that's your HbA1c, and that gives a bigger picture of how your blood sugars have been doing. You can get starting usually around age 40, unless you have something that would say you needed to have it earlier, is a baseline EKG and a baseline chest x-ray. This is really important. I would not have thought this, but particularly since COVID, It's really important to think about because when you get pneumonia or upper respiratory infections, or you get, goodness, so many other things, any kind of respiratory illness, you can get scar tissue. And that's really common with COVID. And once you start getting scar tissue, that scar tissue can sometimes look like nodules, can sometimes look like tumors or cancers or masses. And so getting that baseline chest x-ray can actually help you later on, because people are more likely to get pneumonia and other respiratory illnesses later in life. They can go back and look and see, okay, is this a stable scar tissue situation or a stable cyst situation, or is this a new development? It can be difficult to get scans and to get biopsies in the lungs. So that's why it is even more kind of helpful to know that. My husband has multiple areas that are being monitored. They call it watchful waiting to see if those develop. So every 6 months for the last 2 years, he's been having these scans because he has a spot on his lung that looks like it could be a tumor that's progressing, that's growing. And growth over a certain amount of time is how they determine whether they think it's cancer or not. Cancer usually grows and tumors usually grow over 10 years before they're ever detected. And I think people don't realize that. And so they're monitoring this for him, and it's difficult to get to biopsy. And so having those previous scans let them see what scar tissue from pneumonia and COVID and kind of some pleural effusions he's had, and what is new growth. It's been really, really helpful. So we're really thankful that our primary care provider actually does those on a regular basis every year. Um, Again, usually starting at 40. Same thing with the baseline EKG. It's really, really helpful to know if you develop something later in life or you've already always had an arrhythmia or something like that. Thyroid health is also really important. The first major diagnosis that my husband had with his health was when he had thyroid cancer. And that was detected by a physician doing a palpation, just meaning that they touched his thyroid. And there's a technique that you do. You stand behind the person. So this is not something that you do at home, but you stand behind and you have them swallow, or you have them, have ice in their mouth and swallow, and they're able to, displace the thyroid gland and check on both sides, having the patient tilt their head and look down. And so that's not something that you're going to do at home like you would a breast exam. But if you feel tightness around your neck, if you can see a protrusion that, again, back to butterflies, that looks like a butterfly, that is the shape of your thyroid gland. You have 3 lobes, and it looks like butterfly wings right here. And then you've got the middle of the butterfly in the middle. If it's tight, if it's sore, if it's swollen, if you can visibly see something kind of protruding out, that may be the time that you want to go and ask them to check your thyroid, your levels, and palpate it. So when they did that for my husband, he had no complaints other than there was a little tightness there. And that happens from time to time. We get inflammation there sometimes. And when they palpated it, they could feel a nodule. And when they did the biopsy the following week, it was thyroid cancer. So he had a total thyroidectomy. And so just that simple palpation, there was no other indication, that saved his life. And that's pretty amazing because at that time, we had not finished having our children. So if that had not been detected, likely we would be missing our Mary Claire and Charlie. And so just something as simple as going for that regular health exam really saved his life. And then immunizations, doing those annually, things like the flu, your tetanus booster as recommended, pneumococcal to protect against pneumonia. Once you get to be in your 60s and later, that's typically when they want you to have that vaccination more regularly. Hepatitis, your colorectal screenings after age 50, unless you're high risk, and that could then move to the early 40s. A colonoscopy every 10 years, or you could do the fecal occult blood test or fecal immunochemical test annually. And you can order those kits or get them at a local pharmacy to be able to test that at home. And so lots of good things to kind of know about and to kind of schedule. Other things you want to know about is mammography, so getting a mammogram, or thermography, which is where they use the heat sensors to detect breast cancer. It is not the gold standard, but many people do not like to get mammograms. Usually, mammograms are not ordered for under 40 because women have fibrocystic breast tissue. They used to call it fibrocystic disease, but it's actually where the breasts are really dense and thick and fibrous, meaning that they've got, it looks like roots, they're very thick, and it's difficult on a mammogram to detect that there's a problem. So young women typically have ultrasounds if they suspect there's a problem. I feel like my husband and my family, my kids and I, we have a big family. I feel like we have an example for everything. But in my early 30s, before my blood pressure got high, I started having a lot of tenderness on my left breast, and I palpated doing my self breast exam and I found a lump. And I thought, oh no, this is not good. But I'm glad I found it. And so I went to my primary care provider. They were also concerned. And at the time, we had a breast health specialist in Tuscaloosa. And so I went to see them. I was referred, and they were able to do an ultrasound, and they were able to see that I did have a nodule or cyst, is what they called it, that needed watchful waiting, and that I had multiple lymph nodes in my axilla or in my underarm, which is where young women tend to have breast cancer. And so, of course, I panicked. And so I was followed for 3 years. I had scans every 3 to 6 months for 3 years in my early 30s, until just suddenly one day everything was gone. The nodules was gone, the inflammation was gone. I had redness at the site, which again is very common for breast cancer in young women. So I had all of the classic signs, and just kind of as a miracle, one day I went in for my exam and all of it had resolved. And so I'd share that story with you to say, like, most of the time you're probably going to be the one that catches the thing that's going on with you because you know your body best. And so always advocate for yourself. Always push to get more information or a second opinion if you feel like you need that. Men also need to be doing things like a testicular exam. They can do a self test at home, just by doing palpation and making sure that there's no tenderness, no masses, no lesions. They also need to be doing the prostate exam. So, again, after age 50, it's really important to start doing that. Um, there are other age requirements. So if you're high risk, or if you have really high risk, like a first degree relative, like a dad, a grandfather, a brother, you might start that at age 40, but your healthcare provider can kind of decide that. And then you've got things like stopping nicotine, vaping, or tobacco use. Making fiber your friend can be really helpful for gut health. And then building muscle and working toward good bone health, because after you're in your 40s, that's when your ability to maintain your muscle mass starts to decline. It doesn't go away, but your ability to regenerate your cells, your ability to build muscle mass, it really starts to peak in your 40s. And then the rest of your life, you're really just maintaining what you can do. So building muscle now is really important. And if you're over the age of 40, don't let that make you not do it, right? Because everything that you're doing to maintain is helping you stay active. Muscle mass and being able to do things like squats and functional movement are the biggest things that help you extend your life and your longevity, because activities of daily living, we call those ADLs. Not being able to do ADLs is one, and having falls, which is about balance and muscle mass. Those are the reasons why people will sometimes end up going to a nursing home or an assisted living facility, or having to have help at home younger than what you would expect, because they're not able to do their activities of daily living independently, and because they don't have enough muscle mass for good health, and they're not able to maintain their balance. And so falls are the number one reason why you end up having very poor health outcomes. Over the age of 60 or 65, if you fall, the likelihood that you may have a poor health outcome, that person may actually die within the next 1 to 2 years, goes up dramatically. And so when you fall and you start to be my age or older, people are going to start asking you, oh, I'm sorry you fell. How old are you? And the reason they're asking that is because if you fall at 40, it's going to hurt and you're going to be sore. It's not like falling at 4, right? 4-year-olds are designed to fall at 4. They're kind of like Gumby. They don't hurt as much usually, and they don't do as much damage. But, you know, 40 and above, you're going to have a lot more challenges in terms of recovering from that. And if you're going to be in the 60 plus category and you fall, that probably really needs to be an ER visit or go to a healthcare provider visit, just to get some x-rays and someone else to lay eyes on you and make sure you're okay. So if you fall and they skip to how old you are, that's probably why they're asking. Additional screenings, the annual clinical breast exam that's done in the office. Your OBGYN can do that. Your medical provider, like my regular family doctor, can do that, has done that. Your monthly self breast exam. I always say that once you no longer have a menstrual cycle, to do it on your birth date. So my birthday is on the 12th, and so I could do it on the 12th now that I have had a hysterectomy. So if you've had a hysterectomy or you're, post menopause, just pick a random date that works for you. Usually you want to do this after your cycle if you're still having a cycle, just because of breast tenderness and changes in the breast due to hormones. Having a pelvic exam, so your OBGYN, that's really important. Your pap smear test, usually you can do that every 3 years with the pap smear test if you've had negative ones and you're not high risk, but your provider will tell you what's best for you. They're very individualized feedback. You also can do something like a bone density test, like a DEXA scan, and that is typically recommended. You also can do a DEXA scan to look at like your body mass index and some other factors around your health and wellness with like muscle mass. That's going to be a little bit more precise in terms of like, okay, you may weigh 200 pounds, but do you have more muscle mass than the average person, kind of thing. And then additional screenings for men over 40 is the annual testicular exam. Again, that's usually done with a urologist. Family doctors usually don't like to do that. But some might, but usually that's a urologist, and they are the ones that will actually do the prostate exam as well. And then the monthly self-testicular exam, again, men don't have a cycle like women do. They do cycle, but they cycle daily, not monthly. And so usually it's recommended that men will do a self-testicular exam, usually in the morning, and they just pick a day and they do it once a month. And then the prostate screening, again, this is looking for prostate enlargement or any kind of tumor. And prostate cancer is usually slow growing, typically. That's not always the case, but usually urology will look at that. But a PSA or an antigen test can be ordered by almost any provider. So cancer screenings, we have a really high rate of cancer screenings among UA employees, and I think it is what Carolyn always attributed to like our health coaching and a lot of the information that we give. And so we love that that's the case, because cancer is one of the things that we really think about when we talk about, long-term health and longevity. So based on the screening guides, breast cancer, cervical cancer, colorectal cancer, lung, all of those are important to be screened for. Certainly, there are other types of cancer, but these are usually the most common. And these are the pretty standard age requirements of when you would start those screenings. So hormonal changes for women, we know all about pre and peri and postmenopause. So pre is before menopause. So really everybody's premenopause in women terms, unless they're getting close to menopause, which is peri. And peri, if y'all remember from geometry and math class, peri means around. So you're around the time of menopause. So I would be perimenopause. I'm around the time of menopause since I've had a hysterectomy. And then postmenopause is actually after you have gone 1 year or longer without a menstrual cycle, kind of naturally. So it's not induced because of hormonal medications like you do with breast cancer treatment or because of hysterectomy. So average age in the U.S. is 51 years old with a range of being 45 to 55. That is usually about 10 to 15 years younger than the global average, which is later 50s, early 60s. And we think it's probably the stress and the toxins and the lifestyle that we have in America. You'll have things like hot flashes, dryness, mood swings, decreased libido, decreased concentration, so brain fog, hair loss, which is very common, weight gain, especially around the midsection, and then an increased risk for metabolic syndrome, which includes things like CVD, cardiovascular disease, stroke, blood clots, type 2 diabetes. For men, they also have hormonal changes, so the testosterone levels drop, and that's significant when you drop 1 to 3% in a male. Because of the way their hormones work, that's a pretty significant change for them. So that's things like decreased libido, but also when you're talking about decreased libido, you're also talking about decreased motivation. And that's true for both. You're also thinking about dopamine changes, neurotransmitter changes in the brain. Hair loss, fatigue, mood changes, loss of muscle mass. Testosterone is really needed for that. Increased body fat, particularly again around the trunk, right? The core. Decreased bone mass, memory issues, lack of motivation or depression. Elevated hemoglobin A1C. So this is your HbA1c. Your anemia can change. So if you see a man that has anemia, they're probably going to check their testosterone because it's very uncommon for men to have anemia. And then you can have lots of sexual function changes as well. So erectile dysfunction, you can have changes in your body fluids. There's just a lot that can change for men, but we typically don't really talk about that much. We just might say, oh, they have low T, but that affects more than just their sexual function and health. Same for women. All of these hormones are going to act on other parts of their lives, not just the reproductive or sexual health. So, why can it be so hard? We start to have changes in our digestion, our metabolism, our cells don't grow or regenerate as quickly. Our lifestyle changes. Maybe we're in the sandwich generation where we're caregiving for, teens or young adults or maybe even children. And then we've got probably aging parents or loved ones. And then we start having weight loss resistance and then all of the hormonal changes. Really, it's like, puberty part two. And we try to really focus probably on the aesthetics. We think about wrinkles and we think about skin and we think about weight loss. So I put the chart here. This is just a benchmark. This is not the gold standard by any means, but it is important to know your weight. It's more important really to know your overall weight and your waist circumference because how much abdominal fat you have around your organs is going to be more important than just your BMI without any context. So, people who have a lot of visceral fat around their abdominal area, which is going to be my kind of shape, that is going to put you at an increased risk because you've got a lot of that fatty tissue or subcutaneous fat that's surrounding the organs and putting pressure on them. So, some health strategies. We've talked about some hard things. The strategies are really just to figure out what your needs are and to fill in the gaps. So, there is not a prescription or a perfect formula for how to do life well. Particularly after age 40, there isn't. It's too individual. But we can give you some ideas. So, preventative health care, maintaining a positive attitude, getting enough sleep, good quality sleep is important, moving your body, eating more foods that are plant-based and healthy for you, drinking more fluids, really getting your finances and just all of your kind of admin, home management things in order, maintaining a healthy sexual health life. That's important and sometimes becomes really the root of jokes, right? Like stand-up comedy jokes or sitcom jokes. But a healthy sex life is important. That's on Maslow's hierarchy of needs. If y'all aren't familiar with that pyramid, Psychology 101. We love to talk about Maslow and Erik Erikson. So Erik Erikson's stages of development and then Maslow's hierarchy of needs. Sex is actually listed on one of the primal needs like food and oxygen and water and shelter. So that's important. Confront vices. I pulled this from the article that's linked here. You know, vices may not be the word that I would use, but vices, it's just anything that may not be overly helpful for you. And we all have them, right? We all have a vice. And then meditation can be really important for your brain and for your health. So we've got a class on wellness basics and we call it 5 to Thrive. And it's all about sleep and hydration and a healthy plate. So good nutrition, moving your body, and then meditation. So giving your brain a break. We've got a whole class on that. You can go to wellness.ua.edu to get more information and to watch that old recording. It is a YouTube video, so you can go play it back, but it's really about taking care of the basics first and then trying to problem solve or fill in the gaps for everything else. A lot of times, like when the house is on fire, the analogy is you call the fire department to put it out, but then you have to like slowly start to rebuild. You can't rebuild while the house is on fire. And the analogy is if you're not getting these basics done, then you can't really build anything else because your body probably, is kind of metaphorically on fire. It's needing the basics to survive. So overcoming weight management issues, there are a lot of products and strategies out there. I think it's really complicated to talk about weight management, but I would say to, partner with a nutritionist. We've got some great folks at UMC. There's also the Nourish app that our Blue Cross Blue Shield insurance pays for, and you're connected to a real life registered dietitian nutritionist in Alabama. I've used them and I had great success with that. Of course, there's GLP-1s and there's every diet known to mankind, which I have tried all of those since 1998. I have been on a perpetual diet since I was 12 years old, when my pediatrician and my mother put me on a diet plan. And so I can definitely talk weight loss with you guys, but it's so individual. Start with the basics first and just add in good things and crowd out the bad things, and I say that in air quotes, the sugary things, the unhelpful things. And you'll see a lot of changes. Make sure your blood work is good, because if you've got a thyroid or hormone issue, it's going to be harder to lose weight. You've got things like PCOS, etc. There are some other things that you can do here. Again, this is going to go hand in hand with exercise. I don't believe in just calories in, calories out, move your body. We're not robots. We're not a car. We're not a machine. There are a lot of factors at play when it comes to managing our weight, but getting support in the form of a nutritionist, a coach, a personal trainer. Those are all things that I personally did to help me lose 115 pounds. And I did not lose 115 pounds in a year. It took me 8 years. And I tell you that because most people see the transformations over a year and they give up when they don't reach that. I never gave up because I have been struggling with my weight since I was a child. And it took me 8 years to lose 115 pounds. And I yo yoed and gained and regained. It took me 3 years to get off my blood pressure medication, but I was very determined because I didn't want to be morbidly obese like I was. I was class 2 going into class 3 morbid obesity, which is the highest class. I didn't want to have stroke level blood pressures at 34 and be on hydrochlorothiazide for the rest of my life. And that was my reality at 34. And so I just took baby steps and it took a lot of work. But I was pretty persistent that I was going to make it to the end goal, right? And I did, but it wasn't glamorous and it wasn't an overnight transformation. So I hope that encourages somebody on the call. I was white knuckling it the whole way through. I was like, I will do this, but it was hard. Fitness and exercise, work out when you can get it in. Typically, you want to eat and exercise when it's light outside, and you want to sleep and rest when it's dark outside. That just goes with our body's natural rhythms. But exercise when you can get it in. It doesn't have to be fancy or long. You just want it to be, something that causes you some resistance and causes you to, have to expend some energy. So try not to be all or nothing with your thinking. And again, walking is the best way to start, I think. Just get up and walk 5 minutes, 10 minutes, whatever you can do. That's really why we say couch to 5K, because it literally is just stand up and move your body. Um, some other things you can think about: stretches, making sure that you have a routine, making sure that you pace yourself, making sure that if you have any concerns that you get clearance from your provider to start an exercise program if you've not been doing that before. There are some other tips that you can use, like a menu. So a lot of things that I use and recommend. I love having a chiropractor and a physical therapist. If you don't have a team of experts, I really highly recommend you have someone on your team. Physical therapist, I think, helps so much when it comes to rest and recovery and teaching you how to take care of your body, especially if you've had an injury or a surgery. Chiropractic care is just really good for overall health, but make sure that you get someone that you trust. Ask your friends who they use, and then a personal trainer and a nutritionist is that would be who else I would add to the team as you can. There's some other healthy habits, but my favorite is 40. Remember that the best is yet to come. And I really do believe that. I believe that's true for me, and I believe that's true for you, whatever age you are. and what other health status you have. And kind of as we're closing, I'll put this in here about the sandwich generation. I think it's kind of cute and quirky and speaks to how we are sometimes in that sandwich between caregiving, like I mentioned earlier. So put the pickles on the side. My parents just had birthdays last week and this week. So they're in their early to mid 70s and have a lot of health issues. And so I am, kind of working through that with aging parents and anticipatory loss and grief and just um, cancer diagnoses and heart attacks and still very much in the parenting season. I have 5 teenagers, ages 13 to 18. So I'm in the sandwich generation on 5th year of tenure track. And doing a state presidency that is a 6-year commitment. And so it's all good things, right? But it's all a lot. And so sometimes you just have to do a timeout, kind of like that football analogy. Like, we're going to save by the bell, timeout, let the whistle blow, and kind of regroup. And you have to do that a lot in the season of life, depending on where you are and what your goals are and the challenges that you have. And all of us, myself included, are right there with you. Pain management, know your limits, don't push yourself too much. Doing stretching, exercising. The Hinge app is really helpful. You can use RICE therapy, so rest, ice, compression, and elevation. But if you have aches and pains that last more than a week and you've not had a major injury, then you probably need to see someone to just get evaluated. Inflammation and gut health. Inflammation plays a huge role in how we feel. So the foods we eat, if we have leaky gut syndrome, toxins, infections, stress. Of course, eye health is really important. Wearing our glasses, that becomes more important, especially with all these screens. Wearing your actual sunglasses to protect yourself outside, safety glasses when appropriate. Just trying to avoid eye strain. So looking up and out 20 seconds, at least 20 feet away every 20 minutes to relieve your eye strain, and then protecting against blue light exposure, and of course the exam I mentioned. Of course, sunscreen, we have a whole class on this that we usually do in July when it's super hot outside. But these are just some fun things to remember. You can go check out that talk. It's recorded as well, and kind of know the ABCDE method for checking your moles. And I actually add an F that looks for funny looking. So do you just have a mole that looks funny? It's always a good idea to get that checked out. And then this is the graphic that tells you about that. So we have a whole class on this one. Of course, shingles. We start to at midlife have shingles. I had a good friend that got shingles at 35 because she was stressed. So it can happen at any age, but it usually is stress induced or a reinfection from chickenpox. And so that's important to know. And that's what it looks like. It's usually around the ribs or the back, and that's usually where you're going to see it looks like a rash that just kind of spreads out. It's very distinct. So if you ever see it, you know it immediately. It looks like this almost every time. And I helped spot that on my friend. I was like, oh, that is shingles, but you're 35. And she's like, yeah, I'm stressed. I was like, that's probably what it is. So according to Psychology Today, these are some things that you can do, like with your mental health. If you're not feeling well, we have a lot of great resources in the Tuscaloosa area and at UA. So definitely think about our benefit where you get the 5 visits to go and have a counseling appointment. There's no shame in having counseling appointments. I have been through many seasons of life in a situation where counseling really helped to have someone that's just dedicated to listening to you and to listening to the challenges you're having. So that's really good. And there's some other tips here. And then just habit change. Remember that slow progress is still progress. Just take one little baby step at a time. It's really about James Clear's atomic habits. He named it atomic habits because, like an atom, it's the smallest thing, right? So the smallest habit change that you can make is where we're trying to make changes with our health and wellness. And there's an adage in health coaching that says the more change that you need, so like for me, like the more weight that I needed to lose, the less I could actually tolerate, which was very true. So I had to take even smaller baby steps, right? And so that applies to anything in life, not just weight loss. Here are some recommended webinars. I've already referenced a few others, but these are some of my favorites. And those are all on our website, which you can see is listed here for you. And this is my contact information. I have just a couple of minutes to take questions. I'm teaching today at 1, But if y'all have questions or feedback, I always love getting to connect with you guys.
There was one at the beginning when you posted about which topics to cover.
Yeah.
They said the protein trend and then steps per day.
Yeah. So around 7,000 steps, you're going to hear 10,000. Everyone has a different stat or source that they cite to tell you what to do. But around 7,000 is really the minimum of how many they want you to get. And most people are probably getting around 2,500 to 3,000 steps. So just increasing your steps at all is really helpful. There's a big story about why it ended up being 10, and kind of a lot of myths around the Japanese character for 10 looks like someone who's walking, so they made it 10,000. And then are there really studies to corroborate that that is the best?